Hi, I want to say good afternoon or good morning, but it really depends on where you are in the world in terms of time zones. But I do want to say a special thank you for coming this afternoon or this morning. I do recognize the names on the list who are here this morning, so I appreciate, I keep saying this morning, I do appreciate the names that are there. Let me jump straight into it and kind of just say, what are we up to today? Well, so today is the 24th of January, 2024. At ZP, as much as we like the science and technology that we do, especially around electrochemical biosensing, we're really interested in the commercialization of this. And it's not necessarily our own commercialization, but being part of that kind of commercialization for many other people. Because in the end, I mean, the sort of science that we do is electrochemical. It's actually very practical. If you look at every glucose strip on the market today, it's a glucose sensor. And if anyone's joining in late this afternoon, don't worry about it. We are recording it anyway. So let me go forward and just say we are going to talk about electrochemical sensing today. We are going to talk about the commercialization of electrochemical sensing. And if any of you are kind of on the academic side of things, there's something that they talk about a lot in academia, which is this kind of chasm between really what academia does, which is sort of papers and proof of principles, and then commercialization, which is bringing it to the next level. There's actually a term for this. It's a sort of technology readiness level. So if you, it was NASA invented these kind of technology readiness levels from 1 to 9. And I think it's fair to say that most of the time academia finishes with kind of technology readiness level 3, which says it's sort of done in the lab on lab type instruments. But I think we can really change the course of those things. As I can see, there's quite a few people here now, so I will go forward and try and be efficient. I'm going to just give me a second while I just quickly introduce ZP. I mean, ZP's been around since 2014. Several of you from the US, some of you, I know your supervisor, for example, or the lab leader, and I've known him for longer than I've known ZP. There has been a ZP. But Zimmer Peacock, we've been around since 2014. We are ISO 13485, so we're certified to do contract development, contract manufacturing of electrochemical biosensors. Today, if you're interested in commercialization of electrochemical sensors, it doesn't always have to be medical. It's just as interesting to play in the environmental space, water quality, agriculture. These are all good applications. We do a lot of food quality and food testing. So please, obviously use your imagination, but there's lots of problems in the world to be solved, and it doesn't always have to be medical diagnostics. That said, medical diagnostics is one of the hardest spaces to work in, and that's where we work. We do have a nice facility. We have them in the UK and in Norway. My colleague Guyana is online this, I want to say again, is online today. This is Guyana, but you'll see her for real, let's say, in about 20 minutes. I will talk fast just to be kind of quick, but the team is international, 23 languages are spoken in the business, and we're fairly large. The facilities are not, kind of rough benches and stuff like that. No, these are class 7 clean rooms with class 5 zones. One of the things that, if you want to make a really good biosensor, you probably have to do it in quite a clean environment. That's one of those sort of things that obviously at ZP we do. We do have these nice facilities, both in Norway, and we also have facilities in the UK as well. This is Swansea, and we also have a facility in Coventry as well. So that's ZP. Now, what I'm going to talk about today is SenseItAll. So SenseItAll is an OEM platform. So OEM really means original equipment manufacturer. So when I first kind of came out of academia and into industry, I never heard of this term OEM. But there's many products in the market today that you may handle, and they may be sort of badged as like Philips, maybe Sony, Toshiba. But you actually find out that there's really another manufacturer behind those, and they're just the brand owner. I can't say in particular in those cases, but it would be in a classic where you would actually get some goods were actually manufactured elsewhere, but at the end of it, they were badged and distributed by a different manufacturer. So an OEM is the original equipment manufacturer. So I'm going to use that term quite a bit today. But at ZP, we have this SenseItAll platform, which is really an OEM platform. Now, what I am going to focus on today is the middle image here, which is this electrochemical OEM platform. So many of you, I can see some people from the UK are here today, and I'm working with some of the supervisors in the UK. They will be getting some of these screen printed electrodes. soon enough. In the US as well, people will be having these kind of screen printed electrodes. So the central platform here can take our kind of screen printed electrodes. But don't think of these screen printed electrodes as kind of in isolation. Actually, they fit into an entire ecosystem. Now, part of this ecosystem is also wearables. I'm not going to do wearables today. Wearables is really tough. In fact, this watch that we've got here has had something like 20 million euros or US dollars invested in it so far. So wearables is pretty tough. Doing IVD, in vitro diagnostic testing, or spot testing, which is really what the middle platform is about, is actually, I don't say much easier, but I would say is almost like an order of magnitude easier to do. So this is an OEM solution from Zimmer Peacock. Now you'll see Guyana talk about this, but it's really designed to work with our screen printed electrodes and our biosensors. But it's not the end of the road in terms of the science and engineering that has to take place. But what this piece of hardware does is there's no more slots. So if you're used to kind of electrochemical potentiostats, especially these small ones, people have these kind of little slots and they have to slot these screen printed electrodes in. It's okay in the lab, but it's actually not very good as a customer experience. You know, customers are not necessarily as dexterous as us. If you're making a medical diagnostic, you can't assume that the end user is, has got the dexterity in their hands as you have. So no more slots on this instrument, and you'll see the significance of that in a bit. Elegant cartridges. You'll see when Guyana's putting new sensors onto this, it aligns itself. There's no kind of, I need to get this right to make sure all the pins line up. There's none of that. It's cleanable. You'll see that we can dismantle it very quickly, give it a wipe down. If you were trying to do a kind of a sensor that was going to be detecting in urine or blood or saliva, if those materials get onto the sensor, you need to be able to clean it quite easily. The user experience is really guided. Guyana will show you this, that LEDs change color depending on the status of the machine. Is it on? Is it Bluetooth connected? Is it running an assay? Has it uploaded the data? This device is compatible with Apple and Android. So when I talk about this device, just know the context of this is, if you are doing electrochemical biosensor development, within 3 months, we can have you basically being able to give hardware to, let's say, real customers. But it is compatible with Apple and Android with their smart devices. I'll show you that. It's cloud enabled. This is the good bit, that every time let's say an assay is run on this piece of hardware, all the data goes to the cloud. It's really important. So let's say you were developing a new test for measuring cardiorenal health, or measuring liver, the state of health of the liver or something like that. You would actually it would be good if that data is going to the cloud, because otherwise you get a phone call from the clinician. He says, I don't think this thing is working. And he's like, you've nowhere to go. What we're doing is, we use this technology stack in with our clients. And if they've got a problem, whether it's in the USA or in India, and these are places I'm supporting at the moment, I can log on, see the data, and make sure everything's working okay. And there's nothing worse than trying to send files by email. Order fulfillment. So if you're building a business, how do you then fulfill the customer order? We'll discuss that. This is priced very aggressively. What I mean by that is, it may sound ridiculous when I say to you, if you order 10,000 of these, they're $60 or 60 euros each. But 10,000 is nothing in terms of really being a business. That you would hope to be selling more than 10,000 units per year. Otherwise, it's not a business. So it's really aggressively priced as soon as you get to volume. It's compatible with microfluidic cartridges. So at ZP, we have in fact, this is a simple microfluidic here. This is the kind of microfluidics that it's compatible with. Anyway, just to say, if what we're talking about today sounds interesting, or you want other colleagues to kind of participate, just know that at the end of this, we'll send out a link to this video. It's all being recorded now, and there'll be a links underneath as well. And there's another webinar like this next month, but it won't be like this. We're always kind of adding new material or updating material, so it's not just a kind of a repetition, let's say. I've hinted at it, but the philosophy at ZP is really this simple. And the philosophy is, we think that there are people, either patients or farmers or environmentalists or statutory bodies, that could all benefit from being able to measure something. If you want to improve society, you have to be able to measure something. Otherwise, it's not. If you can't measure it, you can't improve it. So we want to measure something, and it could be the nitrates in water, it could be the glucose in a patient, it could be something in tear film. And then there's people, I think, often like yourselves, who actually want to provide solutions. And then there's this chasm, and this is the chasm of death that basically exists in academia. But what we're doing at ZP is saying, okay, there's this thing called the SenseItAll platform. It looks like a product, it smells like a product, it sounds like a product, but it's actually the bridge between what you want to do in the lab and what you would want to actually give real people in the, let's say, the real world. I've put two elements to this. There's the hardware and there's the sensor, because a lot of what we do at ZP is around about making a measurement, the measurements run. You can't often reuse these sensors because they're actually contaminated with, biological materials, and it's very hard to write a standard operating procedure, an SOP that says, well, I can take that sensor, clean it, and reuse it. You can never guarantee cleanliness. So unfortunately, there is a sort of disposable built into this. And I say unfortunately because I understand about sustainability. So that is the next challenge in vitro diagnostics, is actually sustainability. But sustainability might not be in reusing sensors. It might be in the use of materials that we use for these disposable sensors. So quick hint to that, rather than using polymers, we might use cellulosic materials. But these people on the right-hand side would benefit from the technologies that we'd like to provide on the left-hand side. But it often doesn't get across because, in fact, the instruments and our sort of philosophy means that literally we can't get the material, we can't get our science out of the lab. So at ZP, we don't believe in that. We've got this SenseItAll platform, and if people are using our kind of either our biosensors or our screen printed electrodes, they're much closer to the world of products than actually they would otherwise think that they were, especially if they're using the SenseItAll. So here's a screen printed electrode from ZP. It's maybe you functionalized it to be a sensor in some way. Maybe it's one of our sensors off the shelf, and that end user will put a sample on it, and that sensor will actually sit in the platform. Now there's the app. So if you're using an Android or a iOS device, then be ready with your QR code reader, because I'm going to put a couple of QR codes up in a minute. But what I'm going to say is we have an app. You'll be able to install it on your phone. That app will drive the meter, and that meter will drive the sensor. But there's a cloud system called Julie running in the background. So I said earlier on, it's important that all the data goes to the cloud, and I mean it. Because then when you put all the data in the cloud, then if you see problems, or you see that the usefulness of that sensor, or that sensor is not really quite as good as you want, you are able to deliver something quite early to the alpha and beta testers. They test, the data's in the cloud, you can see it, and you can start thinking about actually how to improve it. And so you're in a sort of cycle of them testing, you seeing the data, you improving, them testing, you seeing the data, you improving, them testing. You're in an actual cycle here. Now, what we're doing here is actually from the philosophy of lean startup. And the lean startup is not a new philosophy, but I think it's new in terms of it's not necessarily taught in the scientific disciplines or the maths, engineering type disciplines at university. But lean is a philosophy, and it is a philosophy that we apply at ZP as well. So the SenseItAll platform, this is the hardware. It looks quite nice. The fact that it looks quite nice is good because it actually really helps with really customer adoption. So much of kind of early prototypes or early minimally viable prototypes are sort of ugly breadboard things. This is not that. It actually looks more like a sort of, almost, dare I say it, more like an Apple type product. So this is what it looks like. And it can run electroanalytical techniques. So it can run amperometry, potentiometry, voltammetry, and impedance spectroscopy. So it's pretty robust. And so at ZP, we're sort of fairly synonymous with these electroanalytical techniques, and that instrument can actually do it. And it breaks the disconnection, I think, that no disrespect to CH Instruments. I do actually have them in my garage here. I'm not using them at the moment, but as a potentiostat, and there's many other like it, it sort of sets the wrong tone. So let's say you're in the lab doing some research on an instrument that looks like this. It makes you think that you're doing lab work, and therefore your lab experiments are not easy to conceptualize to actually being products, and so especially when the instruments are about the same scale as a laptop. So what we're doing is actually, this is like the potentiostat, and it looks exactly like the SenseItAll platform, because in fact it is the same technology. So suddenly the instrument that you're otherwise developing upon is suddenly very close to actually being something that you could then just go and give to people. You would never imagine yourself giving your potentiostat to somebody, but actually when you're handling this, and you'll see Guyana or her demonstrations later on, you're like, oh, actually, so what I do in lab now is directly translatable to actually a product. And I think it's that directly translational bit that's really broken at the moment. And that's why there generally is a philosophy at the heart of ZP. And the philosophy's always been, how do we get it from the lab onto the market? And we do it for ourselves. But the reason we do it for ourselves is really to also kind of prove a point that actually we can do it for others as well. These links, I'll put them underneath this video later on. I'll send you all a recording anyway, so don't worry about it too much. Now, what you will see in a bit is that we have these sensors and we have this hardware, and all this hardware actually talks to an app, and the hardware will actually, and the app rather, also talks to our cloud system as well. So if you're working with us or you develop your own sensor on one of our screen printed electrodes, they will go into the meter. The sample will go into the sensor. The meter will be told what to do by the app, and the meter will give the data to the app, and the app will give the data to the cloud, at which point then your user, your alpha, your beta tester will get a result. But what's good is you don't need patient data or anything like that. So all these kind of concerns about patient birth, patient name, patient birthday, patient address, none of that's going to the cloud, but the raw signal will go to the cloud. So that means that if you've got a background in electrochemistry, you will be able to look at that signal and say, is this look right? Just a quality control. Obviously, you can automate that, but in the first instance, you'll always want to look at the data yourself. So your end user gets the number on their phone, but you, as the developer, actually get the raw signal in the cloud, and you can then share it with colleagues, or you can even share it with ZP, but anyone who's on the database. But just know that the data itself is locked behind your username and password. So we can't just come in and look at it. It would be a collaboration that whether we were looking at that. Now, you'll see this in a minute, but this is the hardware. So when I say it's the size of the hand, it is the size of the hand. I've got a sensor sitting in the front of it there. The other video is actually showing that when we're running assays, you will find that there's all these user lights that sort of guide the user experience. And when we want to run different assays, you'll find out that it's actually just a QR code will tell the app what assay it actually is to run. Every time you turn the app on, by the way, you don't need to scan a QR code. It just remembers the last thing it did scan. But the kind of programming became very easy for the end user. It's actually just scan a QR code. Now, this part of the video is kind of interesting at the top left-hand corner here, because here, I was talking earlier on about if you need to clean this, somebody spilled something on it, you can just take it apart like that, take that sensor off, and then you can just reassemble it, and it guides back in. There's no alignment. It's like a cone, and it just guides it back in, so that's kind of elegant. In the other video here, they're setting up the test. They're going to run the test. They'll put the sample onto the sensor, but at the end of it, the data went up to the cloud. So your data... Question is, where is my data? Your data's in the cloud. Where's my user test data? That's always a problem because you've got nurses or doctors trying to send by email or Dropbox or something like that. No, all the data just streams to the cloud. Or if you've developed a new assay and we need to get it onto the app, it's only a QR code is all we need to basically get it onto the platform. So it's really easy to translate new science, let's say, onto the app. At the moment, just for your interest, we've got a QR code for glucose and a QR code for pH and a QR code for nitrate. When I say QR codes, you'll obviously see those, but people are familiar with QR codes these days. One for total antioxidative status, one for, it sounds like a joke, but for measuring the hotness of chilies, and one for measuring the pungency of ginger. But we have a lot of these kind of QR codes already. If you're developing your own assay, it's okay. It'll just mean it has its own unique QR code. It's essentially a key to unlock the work that you've already done. The reason that this can all take place is because we do a really good repeatable screen printed electrode. If we do not have repeatable screen printed electrodes, The whole idea of making rapid diagnostics becomes a lot more complicated because suddenly you're having to do on-site calibration, all sorts of stuff, and it just doesn't work well. You know, we come from the world of glucose strip manufacturing. When have you last seen a diabetic do a calibration of a glucose strip? The answer is you haven't seen that for 20 years. So we do have that mentality, and in order to do that, we have to be really good at manufacturing. So we are really good at manufacturing our screen printed electrodes. If you're interested in doing assay development, please do it on our screen printed electrodes. I'm biased, but you know, disclosure there, I am biased, of course. If you're using an Android phone and you don't have time now to scan this, don't worry about it. But this will actually, if you scan it, it'll take you to the Play Store and you'll see that there's an app there called SenseItAll. You can install that app on your phone. It's useless without the hardware, but you'll see that it does exist. So we've basically taken care of distribution. The distribution of software is already taken care of. Most people can, you know, these days use smartphones and QR codes. This is the App Store version. It is hard to get things on the Apple Store. Apple has a very high bar of quality. You know, they have a reputation for it, and and they live it as well. That you know, you have to have a pretty good app to get it on the App Store. But this is on the App Store. So if you're using a phone, iPhone, you can scan this QR code, and that will put that onto your iPhone. Don't worry if you're not doing this in real time. The recording will come through later on, because then for every, and these are only a small sample, but when you open up the app, the first thing it will do is try to access your camera. Don't worry about that because you allow it, because what it wants to do is scan a QR code. Because once it scanned a QR code, it will say, okay, so now I'm SenseItAll, but you've scanned chili, so I'm going to be measuring chili. Or I am SenseItAll, but you've scanned nitrate, so I'm now a nitrate system. By the way, you can change this, by the way. So SenseItAll means something. It's only the QR code that actually dictates what it's going to do at any one time. So theoretically today, ZP has 40 assays on its website. So we could have theoretically do all 40 of those. As it is, we're more like at 6 or 8-ish at the moment, but with time we'll get there. But what I want to say is this, that I don't know absolutely what you're trying to develop, but let's say you were doing lactate. Measuring lactate in saliva is different from measuring lactate in blood, for example. So those will have different QR codes because they'll need different calibration factors. So there's always new applications. I think nitrate is another one. Whether you measure nitrate in fresh water or salt water, it would require a different QR code because they're very different matrices. So there's, in the end, you know, one day there'll be, you know, I don't want to say thousands of QR codes, but you know, there could be for every different user and every different matrix, there could be a QR code for it. We have taken care of shipping as well. So what I mean by that is this, that if you're a startup and you need to do order fulfillment, one of the value adds in business is actually finding customers. So you find a customer, but now in order to serve that customer, you have to build an operation. And an operation can mean like 5 people, somebody to package it, somebody to deal with DHL or FedEx, somebody to make sure payments has come through, somebody to make sure that tax duties are being paid. There's all sorts of things going on in operations. But with this system, you do have the option of actually saying, okay, I've got an order, send instructions to ZP. ZP will take either the relevant sensor and the relative not relative, but the correct. We'll take the meter, we'll take the sensors, we'll put them in a box, and essentially ship it then to where you instruct us to do it. So that's obviously drop shipping. We're all used to it through Amazon. They didn't invent the term, but we do actually do that for clients. So in the end, they run a very operationally lean company because really you want to put all your money in make sure you've got good tech and actually making sure that you've got customer adoption. And the back end stuff is not such a value add, in fact. I mean, many people outsource this to Amazon these days. It's just Amazon are not so ready to do biosensors yet. Now, I say here I'm going to do a demo. So what I'm going to do is, and I say what I'm going to do is I will stop sharing. I'll turn off my microphone. I'll turn off my camera. And my colleague, Guyana, will start doing she will start sharing her camera and her screen, and she'll take you through a demo. So good afternoon, Guyana. I'll stop sharing. I'll turn off my camera and I'll mute and I'll hand over to you. Thank you so much.
Thank you, Martin. Hi, everyone. I'm I'm an engineer here in Zimmer Peacock, and I'm here today to demonstrate our SenseItAll platform. I'll just share my second camera and show what I have here with me. I have the SenseItAll instrument, which is connected through a USB-C cable. Right now it's connected to my laptop for powering on, but it can be connected to any power source. And I have two types of sensors here. I have chili sensor and I have ginger sensor. And I also have two different types of QR codes to access this assay through SenseItAll platform. And of course, I have some solutions to test. The first one is Tabasco sauce mixed with a chili pot buffer with 1:10 ratio. And another one is a ginger shot mixed with ginger buffer. And it's done with 1:10 ratio too. So here is the device. On the bottom of the device, we can see the part number and serial number of it. And as you can see, I can separate them. The device is holding together by using these magnets, and it's really easy to slot it in and out. And we have a slot for the cartridge here, and I can show some comparison between like the cartridge and the sensor. You see, it's really hard to hold the sensor because it's really tiny, and there's no edges to actually hold it properly. When we need to insert it inside any instrument, you need to hold the sensor like this, and then it's really hard to match the slots. Sometimes it's getting misaligned. But with cartridge, we solve this kind of problems, and you see there is a holding place. And I'll start with the chili one first. I'll just insert it so you'll see. I'm holding a cartridge from the top, and I insert it here, and then I click it up. So this moving part goes up and down. When I click it up, it brings the connectors of the sensor to the connectors of the device, which are on the top of the here on the main part. And yeah, now it's connected, so it's ready for the measurement. Another good feature for it is this LED guides. Right now we see that it's blue. It means that it's ready to be connected through Bluetooth to the mobile app. And also it has a power button for turning on and off the device. Yep, maybe I'll just start with the demonstration. I'll share the screen of the mobile app. So now the app is on. The first thing that we need to do is to scan the QR code. I'll start with the chili one because I already inserted the chili cartridge. Yeah, and we see that the screen of the home page is changed, and it's now says chili sensor, and we see on the header part it's pink pink colors, which means that chili sensor is ready to be tested. And now what we will do, we'll try to connect the device. For that, I'm clicking the Bluetooth icon. Now the phone is searching for available devices. Sometimes it's taking longer because it's Bluetooth connection. I'll just try again. I'll turn off the device and turn on again to see.
Yeah, it found it.
Oh, it found it. I already
Yeah, it found it. But I turned it off, but yeah, it did find it.
Yeah. Yeah, let me try again. Yeah. Yeah, now it's connected. Now we see that device is connected, and we see the serial number of it and also MAC address. Yeah, the next thing that we need to do, we can change the test settings. I'll just write my name as an operator. And then we have sample ID and cluster name. The sample ID, I'll just write down chili test. And the cluster name, I'll call it demo. So because the data is going to be in cloud, we'll need these two inputs to find it in Julie easily. I'll just go back and then I'll show it later how to find the data in cloud. Now I can go to Assay, and we see that the first thing is to select dilution factor. As I already mentioned, this solution is 1:10 ratio, so I don't need to change it. And it says place and lock the cartridge, which I already did. Please mix the sample well and apply sample to sensor. Usually 50 microliter is enough to cover all electrodes, so I'll just pipette 50 microliter of solution. Yeah, I'm trying to not scratch the electrodes with the tip of the pipette and trying to cover all the electrodes. Now it's done, and I can start the measurement. So this measurement takes approximately 30 seconds. What it does cyclical thermogram and sends the data to the mobile app. And mobile app is posting it in Julie platform, which is our cloud-based management platform. It stores the data there, and also the data gets analyzed, and the results are sent back to the mobile app. So we will see it in the results screen in 1 second. Oh, yeah, got it. So we got around 4,000 Scoville heat units, which is corresponding to whatever Tabasco is claiming. They're claiming to have between 2,000 to 5,000 SHUs. I'll share my Julie screen so we can see the results. I'm already in a cluster called demo, and I see that this is my MAC address of the device, so I'll click on it. Connection is a little bit slow here. Yeah, and I see Julie test, and I see the date when it was done. And we'll click on that. Yeah, and here we see the raw data. We see two cyclic voltammograms, 1 and 2, and we also see how it was analyzed and some peaks, heights, and yeah, all kind of details. I'll go back to the screen and then click done. Yeah, and I forgot to mention that when it says upload complete, we also see that on the device that it's turned to green, which says that we can see the data in Julie. Once I click the button done, it will turn white, which means that it's ready for the next measurement. Now let's test the second sensor that I have with me. I'll click on QR code icon so I can scan the second QR code. Yeah, I scanned the ginger one, and we see that on the top part it's yellow, and it also says ginger sensor, says the sensor part number and how many steps do we need to do to get the measurement. And I'll just change the name to ginger test. And I still want to save it in the same cluster, and operator is still me, so I don't have to change anything there. I'll go back and go to assay, and we see again the instructions. It tells us what to do. It says select dilution factor. I don't need to change it again because it's still 1:10 ratio. And I'll insert the cartridge and click it up so it will get connected. Now I need to apply some solution on it. Again, I will apply 50 microliter. I see some small bubble. I'm trying to Yeah, I'll start the measurement. Again, this assay takes 30 seconds too. It runs these quick thermograms and sends the data to the cloud, where it gets analyzed and stored, and then we'll see the results on the screen. Yeah. Yeah, we got the results back, and it also says upload complete. And we can verify that it's green here. And I'll go to Julie to show the raw data. And we need to click refresh button to see the latest results. And I see that it's here, inject test. And again, similar thermograms and some peaks to analyze the data. Yeah, this was all that I prepared, Martin. Thank you for watching.
No, I appreciate it, Guyana. Thank you for giving everyone a live demo there. And it's kind of nice, actually, because the reason that we like to do the live demo is because it is actually quite hard in life to make technologies that are robust. So to be fair to, well, we've got a great engineering team, and actually they've had to work really hard to make it that robust that you can just sort of turn up, do a demo, and it work. And you can see there that Bluetooth, is not perfect in life, and you got it to connect to the Bluetooth. That's really nice. So just to say, on 27th of February, we're going to do this again. It's not going to be a complete repeat of this, but just to say that if you've got colleagues and you think, well, actually, they would be quite interested in this, then just know that we'll do it again, and I'll send out a link after this particular webinar. So if I was to summarize it, it's really this simple. Like, there's lots of good technologies in the world. I think the real value add is actually in the assay development, and the hardware, really is that there's less value add there, because in fact, when you look at the platform that Guyana's showing today, the app is on the App Store. The hardware is already pretty nice with all those kind of lights, etc. And it already connects to a cloud. So in fact, you can suddenly serve real customers really quickly by getting onto the SenseItAll platform. And it's particularly useful for people who want to develop quickly within companies, and also for people who are in academia and actually want to really get across that chasm and actually get products into people's hands. So I would say, our philosophy is really to develop fast and to get products into people's hands as quickly as possible. So if you've got any questions on this, don't hesitate to reach out to us at ZP. So this is our contact details here. As I say, everyone who's registered or everyone who's attended today will definitely, when this video is finished processing, we'll send you a link, and you can share it or watch it or catch details later on, or maybe install the app. But thank you so much for coming. I know some of you came at quite short notice, so we do appreciate it. And thank you, Guyana. I appreciate it's getting a little late in Norway, so thanks for staying on a bit. Okay, thanks very much.